Hi there, I'm here with Dr. Emma today.
Good morning.
And we're doing our weekly catch-up, and
you
had a good case.
I had a really good case of a lady who came into me having been putting toothpaste on her spots and then developed a rash around her mouth and around her nose. And this was a condition I think we've talked about before called perioral dermatitis, which is where you can get little spots and dry, red, flaky skin, which mainly are around the mouth and occasionally around the nose. And the interesting thing about this condition is that it has been linked to toothpaste, which contains fluoride in it. So this is a massive reason, another huge reason, why you should not put toothpaste on your spots.
I think that's really interesting,
Isn't it?
Because another common cause of perioral dermatitis, which is actually an inflammatory entity we don't really understand, is it acne, is it rosacea, somewhere in between, because it responds to the same kind of treatment. But fluorinated topical steroids are often a trigger, because often it's misdiagnosed for something like seborrheic dermatitis, which can often occur around the side of the nose. You put steroid on it, gets a bit better at the beginning, but then it gets worse and worse and worse, especially when you stop it.
And then you get into a cycle, and then people have to use it again because I can't go out like this, and then you just get into this really vicious cycle.
Yeah, a bit of downward spiral.
So
yes, I think recognising what it is the first step. And then looking at your behaviour. And certainly the first thing I tend to do when I see patients with perioral dermatitis, and I have to say, a lot of girls in the beauty industry, product hopping, not necessarily your friend. And I will take out my red pen and go, no, and get rid of pretty much most of what they're using a lot of the time.
So always switching from all those sort of comedogenic products to something really simple, basic, nothing that's going to block pores or cause any damage. I know. Yeah,
I'll often go right down to using things that with no fragrance, no preservatives, and Avene I find to be one of the best ranges of products like that. To just stabilise everything.
Clear it all out. And then if that alone isn't enough, or you've got quite a severe case, then we've got other things up our sleeve which can actually really help. So what do you start with?
Well, by the time they get to us, it's usually quite significant, isn't it? It's either that or else they're not quite sure what it is. It can be either diagnostic uncertainty, in which case sometimes just a skincare sort out and some topicals might work. But I think the more severe end of the spectrum, they've been suffering from it. Usually, I see patients have been suffering for a few months. Something oral just makes life so much easier and gives us time to get their barrier in good shape before starting perhaps a long-term skincare approach. So oral tetracycline antibiotics tend to be what I go for in the first instance.
And everyone always is a bit reluctant, I think, to take the antibiotics because we're using them as an anti-inflammatory, we have to take them for a bit longer, but actually it means you can then get off the topical steroids and change that sort of vicious cycle. So it's often just to calm it down from inside just for a bit.
It's an intervention.
Exactly, a really helpful way, and then we can add in different sorts of products. And I like azelaic acid in the context of perioral dermatitis. What do you think?
Yeah, I think Avene Skinner tends to work really well. And oftentimes there'll also be an element of rosacea or acne in the background anyway, so it's quite nice to use a simple multitasking single ingredient and start to build a routine one agent at a time.
I think the other thing is sometimes if you can't get off topical steroids is to try a non-steroid anti-inflammatory. So there are a couple of products on the market which are non-steroid and good anti-inflammatories. One's called Elidel and the other's called Protopic. And those can be very useful to get you out of a tricky situation with perioral dermatitis. So a few different things. And I like you say, often it's just not recognised. So definitely something to think about if you are getting bumpy red skin, particularly around the nose and mouth.
Absolutely. I do think this is something that some individuals are prone to, and it can wax and wane a little bit. So I think it's reassuring though to know that there is something that can be done in the short term if it flares back up again, and then a good long-term maintenance approach to keep it at bay.
And also maybe thinking about changing your toothpaste to a non-fluoride toothpaste, because there is some evidence that it can change it, and certainly anecdotally I've seen a couple of people where it has been a trigger, so something to think about.
Very interesting. Hope that was helpful. Bye for now.
Bye.